A lot of people wrongly believe that sleep is a pillar of health, but you think that it's a foundation on which all the pillars of health sit.
If you have a problem with your sleep, it'll worsen just about every medical condition or psychiatric condition that you're experiencing. We know that sleep plays a huge role in making sure both exercise and your diet are on track. I don't consider it a pillar, I consider it a true foundation on which you can build the other pillars of good health.
Sujay, it's fantastic to have you here and virtually meet you. I've been following your content all about, sleep tips and sleep myths and sleep expertise online for, a couple of years now. When I see my patients, so, dealing with patients who have maybe digestive health concerns, it's very easy for specialists and people working with specific cohort of patients to really get tunnel vision and focus on symptoms that they present with. So, for example, I might see patients who have constipation or who have acid reflux. At the face of that, it's just a problem that you need to fix. Okay, you need to eat less spicy foods, or you need to take laxatives, eat more fiber, drink more water. That's the kind of fix that a doctor may provide for patients presenting with those symptoms. But actually, if you take a more 360 holistic view, is there an underlying lifestyle factor contributing to acid reflux or constipation? And then, one of those channels when you're going backwards could be an issue with sleep. Their whole sleep clock and habits with regards to their sleep hygiene may be so out of sync that could be contributing to the symptoms of GI dysfunction. Like, even if you have a poor night's sleep, you're more ravenous and hungry in the morning because of a derangement in those appetite hormones. And you can see how it can affect digestive health in that instance, but other things as well. So I think even for physicians like me focusing on a specific cohort of patients, it's important to dial back in on those lifestyle habits, particularly sleep, which could be an easy fix instead of giving someone medication.
Absolutely. The challenge we have with sleep is that once you open up that box, it's then you have to be able to deal with what you've opened up, because there's so many things that, as you mentioned from a GI standpoint, if you take the holistic approach and you look at the entire patient, all the different factors that can play a role, then we dive into the sleep aspect, for example. In my clinic, similarly, it takes me an hour to figure out what exactly could be going wrong with sleep, because again, we have to take that holistic approach regarding the issues at play. And so it is challenging. And the one, I think, failure of at least our medical system here in the US is that we just don't teach much about sleep medicine. And so I think many practitioners are reticent to open up that box because then they don't know what the next step may or may not be. So but I do think it's important to still ask. And, if you are taking sleep into account, there are resources out there. There are physicians, healthcare providers out there that can then address the sleep issues if that's a problem.
So, let's take a look at sleep overall from a macroscopic point of view. You 24 hours in a day. What is the sort of systems and neurotransmitters and hormones at play which dictates this kind of ebb and flow of our sleep cycle, which makes us feel sleepy towards the evening and makes us feel alert during the day?
Yeah, it's a great question. When it comes down to sleep physiology, we think there are two main processes at play. One is a circadian rhythm that is modulated by the suprachiasmatic nucleus within our brain. That's the master clock. But interestingly, we have clocks throughout our bodies that help keep us on track. That gives an alerting signal, a natural alerting signal that ebbs and flows throughout the day, increasing throughout the morning, taking a little bit of a pause around noon, which everybody blames on lunch, and then, really ramping up nicely throughout the evening hours, and then low again when it's time to sleep. That is superimposed on top of the homeostatic sleep drive, which is modulated by adenosine, the main neurotransmitter that tells us how sleepy we should feel based on how long we've been awake. And the more adenosine we have in our brains, the sleepier we get over time. And the two processes work really nicely together to help keep us awake at certain times and sleep at certain times.
I think if you look at that sleep physiology, that 24-hour clock of our day, it's kind of a nice blueprint as to how you should function and when you shouldn't do certain things. Like, for example, you mentioned there that you get that natural dip in the afternoon, maybe between 12 and 2 p.m., which you said people blame on that postprandial slump after lunch or whatever. But maybe if you were considering a nap, that could be a nice time to do it to align with your normal dips in energy level. And maybe even as you become more sleepy throughout the day, I know in seeing some patients that as you get later throughout the day, that your digestive function also slows. So maybe try to avoid large meals at the end of the day, which could worsen your sleep and, affect your digestive health. And in that sort of morning period where you've got most energy, do your most arduous tasks, which require the largest cognitive effort and physical effort, maybe. So it's a nice kind of blueprint for your day.
Absolutely. It's interesting. If you're really dialed into your body's circadian rhythm, what we call your chronotype, when you tend to feel the most alert and awake, and people can look this up. There's a great survey. It's called the Morningness Eveningness Questionnaire. They can Google it and find it. It really gives you a sense of what your chronotype is. Are you a morning person? Are you a night owl? And then you can actually cater, if you have that flexibility, your work to the times where you're going to be the most alert. And there are many people that are saying, well, I'm a natural night owl. I get my most productive hours late at night. I can knock out any task. Whereas your morning birds are going to say 6 a.m. I don't need an alarm clock. I'm up. I'm ready to go. And I want to get all the work done first thing when I wake up. So if you cater to your chronotype, you will likely be a much more productive person and hopefully have a lot more time to do other things you enjoy because you are so productive with the work that you have to do.
So how much of that chronotype, the sort of when you're feeling energized and when you're feeling tired, how much of that is down to genetics and how much is down to environment? Because I feel that in the modern age with social media and digital devices everywhere, a lot of people have claimed the title of night owl, but is that because of bad habits rather than them genetically being predisposed to feeling higher energy later at night?
Well, there are three main factors that play a role in where your chronotype is going to sit at any given time in your life. One is age. We know that as we age, we have a preference for certain chronotypes. So toddlers tend to be morning people. Teenagers tend to be night owls. When we hit our golden years, much later in life, we tend to revert back to being morning people. So your age is incredibly important. The second thing is definitely your genetics. If you have two biological parents that are both night owls, as an adult, you're likely going to have night owl tendencies and preferences. So genetics definitely plays a role. And then third is the environmental factors. And so if you're getting exposure to light at the right or wrong times, that will certainly set your circadian rhythm because we know we can change our circadian clock timing whenever we travel. That's what we do. When we cross time zones, we are resetting our circadian rhythm. So you can set it based on environmental cues and stimuli. And depending on where you set it and what you're exposing yourself to, you may inadvertently become more of a night owl, even though you don't want to, which is usually the main direction things go. Or you might be more of a morning person, even though your body naturally has night owl tendencies.
So if we look at the distribution of different chronotypes in a population, and if we look at a sort of, I'm assuming it follows a bell curve distribution in that the majority of people will be somewhere between night owl and morning larks, and then some, maybe a small percentage will be night owls and a small percentage will be really early risers.
Yeah, it's a great question. And I don't think we have large enough epidemiologic studies to say where people are going to truly fall on this curve. But you're right. Many people, although we like to think of it as, kind of binary, night owl or morning person, most people likely fall into the middle region where they have either slight tendencies one way or the other, but not a huge preference either direction.
So how does someone determine their chronotype just by, I guess, tracking their sleep and keeping an eye on their own sleep habits? What's the simplest way to figure out what you are?
Yeah, one of the main ways you can do it is give yourself, if you think back to your last vacation, what is your natural preference for wanting to sleep and wake up? If you had no obligations, if you had no job, if you didn't have kids waking up in the morning, when would you prefer to sleep and wake up? And that's probably the main indicator of where your chronotype actually is. But there are the other questions you can ask, which is when you feel the most alert throughout the day, when you start to feel that slump. If you feel that afternoon slump at 3 or 4 o'clock, as opposed to between noon and 2, you likely have more night owl tendencies. Your hunger cues can also play a big role here. This is a clue that we have to teenagers being night owls. When they say, when I wake up in the morning, I'm not hungry at all. That's because our hunger cues also follow a circadian pattern. And so if you're a night owl and you're forced to wake up really early in the morning at 6 o'clock, that's like me putting a plate of eggs in front of your face at 3 a.m. for you. If you're not a night owl, you're not going to want to eat that. And so these are all clues to where you may fall with your chronotype.
So there's obviously this clear conflict between many people's natural biological tendencies. So if they're a night owl, for example, and society's expectations. Most jobs, have this sort of 9 to 5 structure. And if you're a night owl, that may not comport with your own biology for various reasons. So how can one change their chronotype to become accustomed to this, their job plan, life plans, having kids, all these sort of things?
Yeah, absolutely. We live in a morning bird world, especially in healthcare. It's a morning bird world, and it's really challenging for folks that have night owl tendencies. I think I have night owl tendencies, and training was a challenge. So there are things you can do. So if you, and the direction that people usually want to go is they tend to be night owls, but they have to get up really early in the morning to go to work or take care of kids, etc. Now, the main cue that helps set your circadian rhythm is light exposure, the timing of light exposure. And so the circadian rhythm is there to help keep us on track with the day-night patterns, in the environment. So, and this was established well before we had artificial light. And so if you expose yourself to lots of bright light in the evening hours, it's both the brightness and the duration of exposure that is going to trigger your brain to think it's still daytime outside. And your body should be doing what it does when it's day outside, which is being awake. And that will shift your circadian rhythm in the later direction, the direction you typically don't want to go. And so our usual advice is trying to limit bright light exposure for 20, 30 minutes before bed and actually getting bright lights upon waking up in the morning. That bright light exposure in the morning is what helps keep your circadian rhythm online, because we think our natural tendency is actually have a 24.2 hour day. And every morning when we get that light, it actually resets us to about 24 hours. So bright light exposure in the morning, super important if you want to be a morning person. Now, if you want to shift things, you're like, right now I go to bed at like midnight. I'm waking up at 8, but I got to go to bed at like 10. I wake up at 6. Usually the best way to do it is slow, steady shifts in your timing. You can't just make a huge abrupt shift because the circadian rhythm doesn't work that way. We know that based on jet lag. You can't adjust just in a day. 10, 15 minutes of moving up your bedtime, moving up your wake time with that timing of light exposure is the way to do it, so long as you have the flexibility to do it slowly.
I mean, thankfully, in this day and age, a lot of people can take on work from home jobs, remote working, virtual meetings, etc., which allows them more flexibility in their sleep schedules, which is great. However, one flexibility that we haven't afforded, a huge part of our population is our children. I find it interesting because you mentioned there that most kids and adolescents, they have this night owl tendency, and they probably also have a greater sleep requirement because they've got this developing brain, which needs plenty of rest and rejuvenation. And I think there's, maybe not the highest quality data, but some data suggesting that when we delay school opening times to allow those kids to sleep in a bit more and, align with their natural night owl tendencies, they're actually, the performance scores in tests, alertness, focus, all these things improve. So actually, should this be a call to arms for policy change? Maybe, listen, for kids, for maybe college students, university students, should we adjust some of the timings of classes so it's not so early in the morning?
Yeah, the data has grown to the point that it is hard to ignore now. When it comes to our natural preferences for our high school students, our college students, even our middle school students, the goal is to not have school start before 8:30 in the morning, because you're truly doing a disservice to their natural sleep need and where their biological clocks are set. And we all, unfortunately, oftentimes here in the US are doing things the opposite direction, where high school starts very early and elementary school starts very late. And it really should be flipped, because your younger children, your elementary school children, are natural morning people, whereas your middle school and high schoolers are night owls. So you're sending them to school in the middle of their brain's quote unquote nighttime, and they're going to perform that way. They're going to be falling asleep first few periods, have a really hard time getting up. And not only does it impact our academic performance, but actually impacts things like risk taking and safety. I mean, you're putting these children behind the wheel driving. And we know that attention suffers, impulsivity gets worse, and just decision making overall. So if you want a smarter child, if you want a child doing better in sports, if you want a child that's safer, we really should we should be making policy changes where school shouldn't start before 8:30 in the morning.
Now, one of the things you mentioned was to shift your body clock from a night owl tendency to a morning bird tendency. One of the main cues from an environmental point of view is light exposure first thing in the morning. Now, I live in the UK where probably 365 days a year, it's not very bright in the morning. I can say that with a certain degree of confidence. In exchange for having natural UV lights, is there any alternatives like, those sad lamps that you can get, which give you some mimicry of UV light? Is any of that beneficial to at least help you set your clock?
Absolutely. So, we have these light therapy boxes essentially, and they're usually 10,000 lux. Lux is what we use to measure the brightness. Those boxes can be very effective in helping with circadian alignment. So if you're in an environment where you have to wake up early and it's dark outside, nothing beats the sun. Nothing beats the amount of lux the sun will produce. We're talking like 100,000 on a nice bright day.
Wow.
Nothing's going to beat that. But a good alternative is these light boxes, and they are bright enough to have a measurable impact on your circadian timing. We think light all the way down to like really dim light can also affect it.
What sort of duration would you recommend?
The longer the duration, the better. But there are going to be limitations in getting to school, et cetera. But I would say that if you're able to have it on duration of your breakfast, for example, you have it in your breakfast nook, you put it in the corner somewhere. You don't need to be staring directly at it. It shouldn't be uncomfortable, but just lighting up the room. And if you can do that for at least in half an hour, the longer the better, because we think the duration is important. But as much time as you can based on your schedule, especially if it's dark outside.
So it's kind of like a 10,000 lux output, maybe 15 to 20 minutes or more if you can. And these are presumably quite easily available on Amazon or Google, wherever you can find them.
That's right. You can find them anywhere online, and they're relatively cheap. I think they've gotten cheaper over time. But yes, it should be accessible for most people.
Now, what we've discussed so far is more about that kind of sleep timing. And another important part of sleep, obviously, is the actual total duration of your sleep. Classically, we've been told 7 to 9 hours of sleep is the recommended for most people. But with this data that we've seen in sleep medicine over the last 20 years or so, I guess there's increasing nuance there to be had, that it's really individualized. And while the majority of people may benefit from 7 to 9 hours or that sort of window of time, there are people who may benefit from more, may benefit from maybe even less, and can survive on less. So how does one find out what their ideal duration of sleep is?
Yeah. So the 7 to 9 hours for adults, will incorporate the vast majority of adults out there. Although that's not what we're getting, that window is typical for the average adult. Your ideal sleep time is one in which once you go to bed, you are waking up before your alarm clock. And that kind of shocks people, like, waking up before my alarm clock? How is that possible? But that's the goal, to get your full sleep need. You're waking up before your alarm clock. You don't need any substances to feel alert and awake throughout the day. You don't need caffeine to really kind of get you up and going. You don't feel a huge dip after lunch when it comes to sleepiness. A little bit is fine, but not enough to really kind of slow you down. And you are not falling asleep in any situations where you're not supposed to be sleeping during the day. Those are kind of your keys to know that you are getting adequate quantity of sleep. Now, we haven't talked about quality. That's a whole other issue. But just from a quantity standpoint, that should tell you that, yes, I'm getting my full need. And you should be able to replicate that day in and day out. Your night should not be perfect. And that's another kind of misnomer, which is, if I'm a good sleeper, I'm sleeping the entire night. All of us wake up at night. Every human being wakes up at night. Waking up at night is not a failure of sleep. It's a normal part of sleep physiology. And when you're getting your full sleep need, you might find that you actually wake up a little bit more at night. It's okay. It shouldn't be an excessive amount of time, and it shouldn't frustrate you, but some awakenings are normal at nighttime. So these are all keys that you're getting the full sleep that you need.
And if we're diving into specific different demographics, just even simply men versus women, there's, been increasing advocacy online that women need more sleep than men. Now, the reasons for this may be numerous: increased metabolic demands through pregnancy, periods, menstruation, various other things like that as well. There's even been some, postulation that there's increased cognitive load on women's brains as well, which is causing them to require more sleep. What is the truth about women requiring more sleep in men? Is that accurate, and why is that?
The truth, based on large epidemiologic studies where we're looking at how much sleep individuals are getting, shows that the sleep need for women is likely a little bit higher than men. But it is nowhere near these statements you hear online about women needing 10 plus hours every day. We don't have any evidence. And even the folks that started that myth readily admit this is just based on my own personal experience and not based on any sort of studies. So the truth is, the large studies show on the order of minutes. We're talking 11, 12 minutes more of sleep time for women. Why is that? Well, we know that women biologically are more prone to issues such as insomnia, mood disorders. Unfortunately, they bear the brunt of child rearing issues at nighttime as well, based on large studies. Pregnancy, menopause, perimenopause. There are so many factors that can affect their sleep, unfortunately, that it's not surprising that they likely need slightly more than men. But again, it's minimal. And we still say, even for women, they fall within that 7 to 9 hour average in most cases.
So I guess we could almost say that because women's sleep is more likely to be fractured because of all of the things you mentioned, periods, pregnancy, rearing kids, etc., mental health issues, increased risk of mental health issues, and all of these various things, the total amount of quality sleep or that slow wave sleep is likely to be less. So to maybe compensate for that, there may be a requirement to just have a greater overall duration to really sort of just get some parity with men when it comes to that quality sleep, despite having a bigger duration.
Yeah, and it's interesting you mentioned that because, yes, fragmentation is likely an issue. We know they tend to have more WASA, wake after sleep onset time. So for sure, women wake up more. Interestingly, the depth of their sleep is actually thought to be deeper than men based on some studies. And so there are some nuances here. But I think the core here is, yes, women likely have more fragmented sleep for a variety of reasons, and therefore probably need slightly longer sleep periods.
So something I've become increasingly aware of is the need to, I guess, have more accountability over my own sleep. My initial stance maybe 3 or 4 years ago was that I was totally against any sort of sleep tracking. And I just sort of went, by ear. Okay, tonight I slept well. Tonight I didn't sleep so well. Maybe I need to, go to bed earlier, not have, some caffeine at this time, wind down some TV or gym before bed. But now over the last sort of 6 months, I've just been increasingly curious about it. What's the hype about, these Oura rings, Fitbits, Whoops, all these sort of things. And I've recently just been, I was gifted over Christmas an Oura ring. And I wouldn't buy this on my own necessarily because it is quite expensive, I think. Yes. But I've just been having some fun, digging through the data and just analyzing that myself. Yes. And actually, when I compare the data from the Oura ring and then compare it to my phone, the natural sleep tracking data it gives me on the phone, on the health app, it seems to be more dense data in the Oura ring and also, more accurate in terms of how it tells me I performed in my sleep. What I want to ask you is, do you think it's helpful to have these sleep tracking apps, or do you think it risks worsening people's obsession over sleep and worsening health anxiety?
Such a tricky question. And I'll tell you, I am thrilled that the awareness about sleep is increasing. So these trackers, this technology, wonderful to increase your awareness about what your body's doing, the timing of your sleep, etc. So that part is fantastic. We do see a segment of people that get so kind of fixated on the numbers coming out of their trackers and trying to biohack and optimize their sleep that they're doing themselves a disservice by becoming just overly fixated and anxious. Oh, my Oura ring told me I slept a 62 yesterday. Why can't I sleep an 85? And I tell them, I don't know what a 62 means. As a sleep doc, I don't know what that means compared to an 85. And so we got to take these numbers with a grain of salt. And I also say that although the technology is improving, none of these devices have an EEG attached to your brain to really tell you what stages of sleep you're in and have a great assessment of true quality. They're using proxy measures like blood oxygenation, heart rate variability, all the things that can help you decide what stage of sleep you're in, but still not perfect. So I say use them to increase your awareness. If you are thinking I'm not sleeping enough, use it to increase your awareness about sleep. But don't get overly fixated on the numbers because you have another tool that can tell you how you feel each day, which is your own brain. Ask yourself, how do I feel this morning? Don't worry about the numbers that your device is telling you.
Yeah, I think that's a really valid point because I think people can become so obsessed to the point where paradoxically it could worsen their sleep, right?
Yes.
And for me, I think the sort of rebuttal I gave myself, my sort of self 4 years ago when I thought, hey, this is going to actually worsen your sleep if you focus on it too much. The response I would have given me was that if your sleep is bad, or if any metrics that you measure, is going to be bad, I would rather not bury my head in the sand and have access to that data so I can be kept accountable and I can take action from that. So, for example, my sleep has always been pretty good. The off bad night or two during the week, fine. But over the last few weeks of, tracking my sleep using these different tools, it just gives me some sort of baseline marker. Okay, so these are the habits that I did, and it got me to this sort of sleep score. Granted, maybe some inaccuracies based on the proxy measures, but I know that if I continue to do these activities, this is going to give me this kind of sleep. And actually, the one day that my sleep was bad, I did do this, or I didn't do enough activity, or something was different. So it's almost a means to an end. And I don't think if you get one of these things, do you need it forever to check your sleep? I don't think so. And I think that would maybe be a failure of the product itself if you required it for the rest of your life. It's just another machine that you're attached to. But maybe for a short period of time, a few weeks, a few months, you have this thing to either rectify your sleep or just out of curiosity, understand what's happening in your own kind of physiology.
I love that way of using it, which is experiment and see what's working and what's not. And the thing that surprises people is really habits such as caffeine use, timing of exercise, the amount of time you're actually spending in bed. People are surprised that, for example, when we have metrics on our phone regarding screen time, like, oh, wow, I'm using it that many hours per day. And then when you get the metrics in the week regarding sleep, you're like, wow, I'm actually really skimping much more than I thought. That's a beautiful way of using your device. Test, see what happens. Now, my pushback on some of these technologies is that when I get that score at the end of the day, and it tells me this is how much deep sleep and this is how much light sleep I got, as a sleep doc, I don't know what that means. I don't know what they mean by light sleep and deep sleep, because naturally we think, oh, well, I have to try to optimize my deep sleep. Well, interestingly, deep sleep, which I consider N3, non-REM stage 3 sleep is deep sleep. Well, light stages of sleep include N1 in non-REM sleep, but also REM sleep. Well, REM sleep by nature is actually a light stage of sleep. And that's why we're more likely to wake up after a dream or in the morning after we're in REM sleep. And I don't know how it's being characterized when people divide it to light and deep sleep. Is REM considered light sleep? Because for me, physiologically, it is light sleep. And it's an incredibly important type of sleep. And so in my mind, it's like instead of trying to optimize this deep sleep, it should be the appropriate balance between light sleep and deep sleep. And that's where a lot of this technology is proprietary black box. It all feeds into some algorithm. Then they spit out a number. And I'm like, I don't really know how you got that number and whether the metrics that you think are important as a technology company, whether I think they're important as a sleep physician. And that's where it can be a little bit tricky.
That's true. I guess on the surface of it, if an app tells you need more deep sleep and less light sleep, from a biological, clinical perspective, that's almost wrong, because REM sleep, that sort of dreaming sleep, serves a different purpose than the deeper non-REM sleep. And they're both equally important in different ways. So I guess it gives the wrong type of validation sometimes, certainly as far as we don't know the sort of proprietary algorithms and how these work. But I think for me, what's reassuring in some instances in that before I accepted this Oura ring, I was doing some research on it, and I looked at the clinical validation, and there seems to be quite a few published studies at, maybe not the highest quality, high impact factor journals, but there is a body of evidence out there of kind of real world data and comparing it to the gold standard, which would be polysomnography, and seeing how accurate it is. And it doesn't seem to be too far away, despite not using, electrodes attached to your brain and various wires. It's not too far away based on the kind of proxy measures even now.
The technology is getting better. And if you have the ability, like the Oura ring, I think the Oura ring is ahead of most of our typical sleep trackers, because I believe they incorporate pulse oximetry. They can incorporate heart rate and heart rate variability. And they can incorporate movement and accelerometer data.
And temperature as well.
So these are great metrics to then really kind of correlate to different sleep stages. So the technology is definitely getting better. And there will be a point in which, the Oura ring can probably diagnose sleep apnea, right? I mean, I'm sure we're going to get to the point where it can be used as truly a medical device. The rigor in which the Oura ring has kind of validated their technology does not apply to most of the sleep technologies that are out there, particularly ones that you're not actively wearing that are close to your body to measure all these various physiologic variables that then feed into the algorithms to tell you what stages of sleep you're in. But yes, there are some technologies that soon you won't need to come into a sleep lab anymore. I won't need to be reading sleep studies anymore because your devices will tell you. And that's great. Maybe not so great for me because I learned how to read sleep studies, but great for society. And that's the more important thing.
But I wonder, obviously, a few years ago, I actually was involved in this kind of health documentary where I tested out my own sleep, wearing this sort of essentially this device on my head, which was almost like an at-home EEG reader, and I slept with it for 3 nights. I actually traveled to the US, so the first night was it tracked my sleep after a long flight and being jet lagged, and I went to sleep straight away, and I had loads of deep sleep. And then the next 2 nights where it was more evened out, and we compared that. And then if I compare the data on that to an Oura Ring or any other tracker, it's not going to be exactly the same, obviously, because it's not going to be as granular in detail. But surely, if the ultimate way to assess someone's sleep is through sleep wave activity from the brain, why hasn't anyone come out with a wearable, consumer-grade wearable that you can stick a small thing on your head, on your temple, and that tracks you instead of having, watches or rings and things like that, which don't get your brain activity?
Yeah, the challenge there is, EEG data is also very hard to interpret. It's funny because sometimes we'll be in the lab looking at the EEG data and saying, is that patient awake? Are they in REM sleep? Because it's really hard to distinguish. Computers had a hard time distinguishing between, numbers and letters until just recently. Now, with AI, I think this is going to improve drastically, but we just have a hard time interpreting EEG data as humans. And so as for computer systems, it's also going to be somewhat, I think, hard. The single electrode EEG also has its limitations because, sleep is a cerebral process involving lots of different parts of the brain, and your EEG signature is different depending on which part of the brain you're looking at. And so all these variables can play a role in making EEG data not as reliable. And then you have the last factor of, can you actually get reliable electrical information from your brain with a single sticky thing that you're applying at home? And you can. There are devices that we use, like single monitor EEGs for research studies, but even that data has its limitations when you look at that compared to kind of the gold standard of a full EEG set up on your head with so many different electrodes. So I think that's a challenging route to go down, as opposed to using the metrics that are reliable that you can get from things like the Oura Ring that have great correlates to the different stages of sleep. So I think that's kind of the path that technology is going down, and probably the smarter path long term.
So say someone didn't want to get any data from all of these wearables and they wanted to do the manual approach of just pen and paper in a diary. What would you suggest in terms of data that they should track in their journal?
Yeah, I think that the key data is the amount of caffeine intake throughout the day, time in bed and time asleep, because those are usually 2 very different things, because we don't want to spend excessive amounts of time in bed being awake. Nighttime awakening frequency and the time they wake up in the morning. Those, for me, would be the core characteristics to say, this is the quality of sleep you're getting, and these are the factors that may be playing a role. Charting exercise, timing of meal intake, I think that's kind of the next tier, but also very important, which could affect kind of your sleep timing. And then looking at variability. So, making sure you're getting at least 2 weeks of data to compare how you do during the weekdays versus the weekends, and looking for big discrepancies regarding your sleep timing on those days. And that can give you a pretty good picture of how you're sleeping. But again, the old-fashioned way, you can go to Google. There's like a 2-week sleep diary. If you Google 2-week sleep diary, AASM, American Academy of Sleep Medicine, a nice PDF pops up, which you can print out and keep track of your sleep timing.
Now, one of the things you mentioned there was, the variability sometimes in weekday sleep and weekend sleep. And I think I was probably guilty of this during my university days when I was in medical school. During the week, during clinical rotations, exam revision, my weekday sleep, I'd probably sometimes average less than 5 hours of sleep during the week. And I would think it was a good idea to try and catch up on lost sleep during the weekends. So, 5 hours of sleep a day, Monday to Friday, and then maybe 9 to 10 hours of sleep on the Saturday and Sunday. So, I was binging on sleep during the weekend, and really my sleep-wake schedule was completely haywire. And I guess it comes down to that sort of this myth, this idea that we can have a sleep debt and then recover and pay off that sleep debt with more sleep at a different time. How true or how wrong is that?
So you certainly can make up for acute sleep deprivation by sleeping in or getting extra sleep. The challenge is that if you are chronically sleep deprived, you do have to pay back a good chunk of that debt. You don't have to pay it back one for one, but it does take a long time. And the reason is, you can't just necessarily sleep for a full 24 hours, even if you are, in debt for, like 16 hours of sleep. So 8 of your normal sleep plus the additional 16, you can't get it in a day. And that's because your circadian rhythm wakes you up at certain times, right? So making it impossible for you to truly make up your sleep debt. Similarly, if you're really skimping on the sleep during the weekdays and you're getting 5 hours, are you going to have enough time on the weekend, the 2 days, to truly make up for that? The answer is almost certainly no, because your body just won't let you get the total amount of sleep you need. The real goal is, one, to try to stick with, be as close as possible to your sleep need during the week and make up for a little bit of it on the weekends. Or two, try to be very consistent and get your full sleep need all the time. If you have to make up your sleep debt, the only real way to do it is to expand your sleep window, the time of you're actually spending in bed, to make it consistently longer than what you think your actual sleep need is. So if you're a 10-hour sleeper, committing to 8.5 hours in bed every single day for a good, 2, 3, 4 weeks to truly make up on your sleep debt.
So I guess if someone has a bad night of sleep and that acute sleep deprivation, the next night they can sleep a little bit more and almost recover and offset a little bit of that damage. But would you say that once you've had a bad night of sleep, that damage is maybe done and you can just try to mitigate further damage the next night? It's not a case of you can completely, paint over the damage of the previous night, and it's kind of just moving forward, and it's like a new table every time.
Yeah, it's a bit of a range here regarding how much you've skimped on the sleep. And so I would say if you've gotten a little bit less, you can likely completely make up for it the next day if you're giving yourself adequate opportunity. Or in the setting of acute sleep deprivation, you could also take a nap during the day to help make up for what you've lost. So yes, it's not ideal for your brain function that day while you're in the state of the acute sleep deprivation, but you certainly can make up for it, and you can be back to essentially your normal functioning so long as you've recovered from the sleep debt that you've experienced.
I guess a lot of adults have problem actually getting to sleep in the first place. That sleep latency and that sleep induction seems to be longer for many people for, I don't know, various reasons. Maybe they're not going to bed at the correct time. Maybe they're being distracted with devices and other stimuli before going to bed. How can someone fall asleep faster, essentially, and just kind of get into bed once they're decided they want to go to sleep?
I think, the number one question, which is, we're oftentimes faced with social media folks saying, this is how you fall asleep in like under 3 minutes or under 5 minutes. So the first question is, well, how long should it take you to fall asleep? And we think it should be somewhere between 10 and 20 minutes. If you're between 10 and 20 minutes, you're okay. Falling asleep too quickly can actually be a sign of a sleep problem, quality or quantity of sleep, and that can be a problematic issue. So 10 to 20 minutes is kind of what we're shooting for here. Now, the foundation for good sleep is what we call sleep hygiene. Sleep hygiene are things in your environment and your behaviors that can help or hurt your sleep. And then looking to see if you could have another sleep disorder on top of that, particularly something known as insomnia, which is a large blanket term that can apply in various situations, or having a delayed body clock. So a lot of people are natural night owls, forcing themselves to try to go to sleep early, running into lots of frustration. And it's actually their circadian timing that needs to be adjusted. It's not that they have poor sleep hygiene or insomnia. It's just the body clock. So these are the things to kind of keep in mind.
So I guess that is probably a mistake that a lot of people make, where they will just go to bed at an arbitrary time, say, I want to go to bed at 10 p.m., but actually their biology may dictate that they only feel tired at 11 p.m. So they're just spending that hour in bed, tossing and turning, becoming frustrated, not feeling relaxed at all, but maybe feeling anxious about their sleep. And that's actually a detriment to their overall sleep hygiene. And in fact, probably they should just delay their sleep and go when they're tired. And that was one of the biggest lessons for me, realizing that I should just go to bed when tired and not worry about the clock. Because I used to be a clock watcher. I used to look at the time. Oh God, it's 11:30. I don't feel sleepy. I need to be up in 7:30 in the morning.
Yes, absolutely. One of the main factors that I'll ask my adolescents that say, oh, I can't fall asleep at nighttime. One of the main questions that helps me decide which route to go is I ask them, do you feel sleepy and tired, or do you feel wide awake when you get into bed? And many of our teenagers are like, oh, I feel wide awake. I can easily stay awake for another 2 or 3 hours. Yes, in that situation, you're setting yourself up for frustration, laying in bed, tossing and turning, not being able to fall asleep. The other side of the coin is somebody that actually feels tired. Their body is fatigued. Mentally, they might be fatigued. They feel like they should be able to fall asleep, but their brain won't necessarily turn off. They're constantly thinking, worrying. The bedroom has become the place where they tend to think and worry, not the place they sleep. This used to be kind of a classic type of insomnia subtype known as psychophysiological insomnia, in which their brain is just too active and they can't wind things down. The classic racing brain at night. And that person is more likely to have an insomnia issue in which they should use cognitive behavioral therapy for insomnia, which is the most effective solution. Whereas the night owl, there are other remedies to help with that shift. We talked about light exposure. This is also where melatonin actually has data to support it, is as a clock shifting agent. And I'm not telling you to go out and take melatonin, but I'm telling you that speak with your physician, because this is a situation where low doses of melatonin at the right time can actually get you lined up in the right way.
So I guess in a way, alluding to something you've mentioned online as well, maybe more people should practice healthy sleep restriction. Not in the sense of, restricting the number of hours of quality sleep, but actually restricting when they go to bed only when they're tired.
That can certainly be helpful. If you suffer from insomnia, one of the core strategies in cognitive behavioral therapy for insomnia is sleep restriction or sleep constriction, which you slowly decrease the window of opportunity you give yourself in which to sleep in. This is best done with the help of a sleep professional, because there are situations in which we don't want to restrict your sleep. For example, if you have epilepsy, if you suffer from bipolar, there are situations where sleep restriction can certainly make things worse. So we have to be a little bit cautious. But sleep restriction and getting into bed for just the time that you naturally feel sleepy and the sleep that you need can be helpful. The opposite can hurt you. So if you have insomnia and you're like, I'm just going to try to lay in bed for 10 hours and hopefully I'll get 6 of those, that's usually counterproductive, because you don't want to spend too much time awake in your bed thinking, because then the bed becomes a place where you're fighting this constant battle of trying to get sleep to come to you, and you're getting frustrated, and that's not fun.
So you said, obviously, you don't want to be battling your own thoughts and anxieties and those, ruminative thoughts when you're in bed, because that's counterproductive for sleep. And historically, the trope was that someone would tell you to count to 100 or count sheep or whatever it is. Yes. I guess there is some similarities between visualizing sheep and, this sort of cognitive shuffling that we've heard more and more about online, where I guess people try to visualize something or try to name random words to almost stop thinking about anything else.
That's right. Yeah. Cognitive shuffling made its rounds on social media. It became very popular. I'll tell you that the data behind cognitive shuffling, it hasn't worked its way into kind of our core strategy for cognitive behavioral therapy, but I think it is an additional tool that can be used. And so basically, you're right. It involves visualizing random words, random pictures, in a way that's somewhat nonsensical and sometimes even kind of unattached, to get your brain into a relaxed state. But the whole goal of cognitive behavioral therapy is for the bedroom to become the place where your brain relaxes and then passively accepts sleep. And cognitive shuffling could be one technique you can add into a broader scheme of cognitive behavioral therapy to help you learn to relax in bed. You want sleep to be a welcome friend, not a battle you fight every night. And cognitive shuffling can help with that.
So one of the cues you mentioned for better sleep is light. And we've spoken about that. Another key environmental cue that is under our control to some degree is body temperature. And we know that, the sleep induction is influenced. The faster we can lower our core body temperature, we can fall asleep faster, and that's ideal. And one of the things for me I've learned, certainly whenever I've actually seen my body temperature and then my sleep, according to the data I'm tracking, whenever I have late night gym sessions, obviously my core body temperatures could be higher. That usually correlates with less than adequate, sleep for that night. So I've learned to try and, avoid these kind of late night exertions, so my body temperature isn't higher and my sort of adrenaline and energy levels are higher as well. What are some other ways beyond, if you have a, fan or a air conditioning in your room, how else can we lower that core body temperature to improve our sleep hygiene?
Yeah, so one way you can do it is actually taking a warm or hot nighttime shower, because that artificially raises your body temperature. We actually think it's the dropping part, the fact that your body temperature is dropping, which helps you get into that deep sleep. And so by taking a hot nighttime shower and artificially raising it, and that quick drop, we think may aid in getting you into deeper sleep faster. When it comes to exercise, as you mentioned, if you are exercising late, but you still find that you can fall asleep fine and have no issues, and that's the only time you can exercise, by all means, go ahead and exercise. But folks that have insomnia, that tend to notice difficulty sleeping with late exercise, it's exactly the issue you mentioned, which is the core body temperature tends to stay high and has a harder time decreasing. Now, there is a limit when it comes to how cool you want to make things. And so We usually think somewhere between 68 to 72 degrees Fahrenheit. Some people would say 65 to 70. But there have been studies in older individuals that show that when you get too cold or too hot, sleep starts to fragment again. So you want to shoot for that good range. And everybody's preferences is somewhat different, but I would say likely somewhere between 65 and 72 degrees is the sweet spot.
Now, there comes a stage in life when, someone might decide to have a young, tiny little human who's wailing and crying throughout the night, and that impacts their sleep.
Yes.
For parents of infants who are struggling with their own sleep hygiene and sleep balance, what are some sort of ideal things they can do? Because I guess, they feel they have to wake up every time the child makes some noise. And there's parallels between this. I don't have any children, but I've got a dog and, he's my child. Yes. Every time he barks at night, I feel I have to go down and check on him,
yes.
And that fragments my sleep. So similarly, the child is crying throughout the night. You have to go and check on them to make sure they're okay. So, is that always necessary? And what other sort of tips can you advise to circumvent that?
Infant sleep is challenging at almost every stage, and the younger they are, the more challenging it is. It really depends on how old your child is. And so, the first 6 weeks of life, children have no semblance of a circadian rhythm. They don't care whether it's light or dark. They're not making their own natural melatonin. It is a crap show, for those first 6 weeks. And parents need to expect that. Don't expect your child to sleep at nighttime. And, you're going to have to go into it with that kind of open mentality of this is going to be kind of rough and early on. After 6 weeks, when the circadian rhythm starts kicking in, more sleep is pushed at night, which makes things easier. But usually hunger cues are still waking children up during those early few months. After about 6 months of age, an otherwise healthy infant that was born on time, that's thriving, that's growing well, most infants have the ability to quote unquote sleep through the night. What that means is they can go a good 6 to 8 hour stretch without necessarily needing a feed or needing the reassurance to get back to sleep. Many children are capable of that. However, they may not be able to do it because they have developed what we call a sleep onset association, the learned behavior in which they need some sort of assistance to help them get back to sleep when they wake up at night. And that's where some of the behavioral interventions like sleep, quote unquote, sleep training come into play. Usually after 6 months, sometimes as early as 4 months, where you can actually help teach a child the important skill of being able to kind of self-soothe and get to sleep at nighttime on their own.
Yeah, I mean, everything that we've discussed, each topic on their own, as you suggested before we started, we could just spend an hour talking about each one of those. Yes. I just want to thank you for the sort of amount of sleep information you provide online, but also coming on here and enlightening people with some really interesting nuggets, which hopefully they can take forwards into their own sleep habits. And I think we've got to get you on again to cover a bunch of other stuff we didn't manage to cover today. So, Sujay, thank you so much.
Thank you for all that you're doing to help spread the good science, my friend. It's not easy these days, and really appreciate what you do. And thanks for having me on.
Thanks again to Dr. Sujay Kansagra. Have you had success with sad lamps, cognitive shuffling, or warm nighttime showers? Share your sleep secrets with me in the comments below. And subscribe so you don't miss the weekly Dr. Karan Explores podcast. I'll see you sleep-deprived souls next week.